In this video, I will go over different trinucleotide repeat disorders. But before I do that, I would like to come up with a mnemonic to explain how to associate different trinucleotides with different disorders. So if you've noticed, three of these disorders, this first one, second one, and last one, all start with C and then end with G. And then for two of them, which is Fragile X, we have G in the middle, and then myotonic dystrophy, we have T in the middle. So we already have two of these out of the way. And for Friedreich ataxia, the second word starts with A, so therefore the second letter and the letter after also starts with A. So that's how I memorize for Friedreich ataxia too. Now, as for clinical manifestations, Fragile X syndrome can be caused either by expansion of CGG repeats, which accounts for the 99% of the cases of Fragile X, or by mutations in the FMR1 gene, which accounts for 1% of the cases of the Fragile X syndrome. So how these CGG trinucleotide repeats work is that they would act on the FMR1 gene and then cause methylation of the promoter and thus silence the gene. So in any case, it's the FMR1 gene that is affected in Fragile X syndrome. And these patients present with mental retardation, enlarged testicles, large jaw, large ears, as well as mitral valve prolapse. The next condition is Friedreich ataxia, which is due to the expansion of the GAA trinucleotide repeats in the frataxin gene. And frataxin is a mitochondrial gene that is required for iron detoxification. So these patients will present with neurological symptoms, such as gait abnormality, nystagmus, and motor weakness, as well as hypertrophic cardiomyopathy. And you should know that this hypertrophic cardiomyopathy is the main cause of death in these patients. The next condition is Huntington disease, which is by the expansion of the CAG trinucleotide repeats. And the mnemonic that you can use for Huntington is CAG, goes for caudate atrophy, decrease acetylcholine, as well as decrease GABA. So therefore, there is CAG. So we have CAG. And these patients present with chorea, dementia, as well as psychiatric problems. The final condition is myotonic dystrophy, which is due to the expansion of the CTG trinucleotide repeats, and these patients could present with baldness, testicular atrophy, and finally they may present with myotonia, which means they are not able to relax muscles. So for instance, once they shake hands, they wouldn't be able to relax and let go of their grip. And that concludes our discussion.